In honor of Dr. Vwaere Diaso, the medical officer who died last Tuesday in an elevator crash, the Nigerian Medical Association has scaled down activities for its annual general meeting. The association says the tragic loss and the ongoing strike by the Nigerian Association of Resident Doctors highlights the urgent need for renewed commitment to the welfare of doctors and improvement of the healthcare system. Sarah Yuko has details.
About a week ago, the medical community was thrown into mourning the death of Dr. Vwaere Diaso, a medical officer who died from mortal injuries sustained when the elevator she was in failed and crashed on the 9th floor on Tuesday. It is still a hard pill to swallow for medical personnel, particularly the house doctors. The annual general meeting of doctors in Lagos starts on a sober note. On the table for the Nigerian Medical Association and the Medical Guild are factors that led to the death of Dr. Diaso and the ongoing strike of resident doctors.
Call off strike from all other general hospitals in Lagos. They're back to full swing, but the 3 hospitals that the house officers rotate, they are still on strike. One is to extensively mourn our colleague. 2 is also give the doctors a very good psychological support because their mental health is very important. They can't go back to work right now. Assure our colleagues and general public that everyone involved and culpable in the gruesome murder of our dear colleague will face the full wrath of the law. Certainly, the death of Dr. Vwaere Diaso must and will count for something.
According to the preliminary report of the panel of inquiry set up by the government on the cause of Dr. Diaso's death, the contractor and installers of the faulty elevator have been arrested by the police, and the Ministry of Justice will take over the case.
What the family will appreciate is ceremonializing this as little as possible. The family still requires a lot of time, a lot of support to have a semblance of absorbing and overcoming this tragedy. I would not suppose that every move and every step of the family should belong in the public domain.
The association has also thrown its weight behind the striking resident doctors. They say the no work, no pay policy imposed by the federal government is vindictive, unfair and inhumane.
Our president came out when he was campaigning that he was giving us renewed hope. We hope that we can see the renewed hope in healthcare and in the healthcare space, and all the sycophants in the Ministry of Health are telling the right information about resident doctors in this country.
For the doctors, silence is not an option. They're expecting the government to prioritize accountability and welfare of doctors.